All right, so I'm going to talk to you about how to work with somebody's hand. This is a crush injury to the small finger, DIP. So not only is it fractured, but he had a terminal tendon rupture due to the crush injury. So anyone with a crush injury to the small finger, relax, 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 has, can have a tremendous amount of pain because all the nerve endings here. When you're working with someone with a finger problem, obviously you want to focus on their finger, but when you have somebody who you're working with that has a finger injury, a lot of times they might have wrist problems and forearm pain because all the muscles that move their fingers and move their wrists start over here. Tiene mucho dolor aquí, ¿sí? Todo aquí. Es porque tú mantienes el dedo así. So he's always, you have to understand, why does he have pain all the way over there? He has pain all the way over there because he keeps his finger completely abducted and extended. So the extensor muscles that control that small finger start up here in the lateral upper condyle and comes down and becomes 4 tendons and goes to these 4, and that's what he's using. So if we want to work some ulnar-sided wrist pain and some ulnar-sided forearm pain, we have to know, why does he have that pain there to begin with, right? We have to be cognizant, say, if we're going to work down there, what are we doing over here as well? So if you're working with someone's forearm and he's completely in the position that got him there to begin with, you're not going to be that effective, right? So if he is always extended, abducted, and in a guarded position like this, and you're not putting him into a different position than that to work, you're not going to be effective. All right? Relájese la mano. Yo no toque el dedo, doblar el dedo. Yo ayudo esta parte, okay? So if I want to be effective here, I've got to support this part. If I'm just working here and I'm not supporting this part, he's always going to have pain, right? So, right? So I'm going to go right there. I don't have to. Let me check. Here. Yo cheque aquí también. ¿Te duele aquí también?
Por todo eso ahí no duele.
Sí. No, un poco, pero más grande. Ay. Okay, so if he has a lot of pain there, I want him to relax into it, right? I want to shorten that muscle, but I want it to not be working. So in order for that muscle to not be working, I've got to support his hand. So his hand has to be heavy and relaxed in my hand. Can you go get me a lotion? El dolor todo parte aquí. Yo empuje muy fuerte.
No.
Fuerte, pero alivia, ¿sí? So, perfect. So I'm going to just use relájese. So I'm putting my hand underneath his hand, and every time he pushes down or pushes away, I can feel it. So I can tell him to relax. It's my favorite word. I need a big old sign, relax. I need it across my chest, relax. English, Spanish, everything. Relax, 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 right? So I'm going to be most effective if I understand why he has the pain that he has, so I can help him not have that pain anymore, right? So he's not having the pain because I'm bending his finger, I'm not touching it, I'm going to be cognizant of where his finger's resting. So I'm not going to do any sudden movements of like shifting myself. My hand stays really steady. If you take a look at my body mechanics, I've got my elbow resting on the table, my shoulders relaxed. I'm not doing anything but supporting his hand here. So this hand is not doing anything. I've got my body lined up in a straight. I'm working close. I'm not like extended out, like throwing my back and throwing at my shoulder. I'm getting my body nice and close, my arms supported, his arms supported, no sudden motions. And there's a reason why. Every time he wants to abduct, I'm gonna tell him to relax and put it into an adducted position because then it's going to relax this part. Relax. All right, and then he's going to be in slight extensions, so I can work his wrist extensors. He might benefit from some kinesio taping just to help him relax, but he would have to shave this part. Maybe on Friday. Muy fuerte.
No.
Okay. Relax, relax, relax. So if I start feeling that he's shifting, which is what I'm feeling, I can reposition. All right? And then I can do a little bit to the small finger as well. All right? So here I'm just, doing some edema. I'm working the whole length of the tissue. I'm going to go the whole length of the tissue. I can go across, right? Oh, yes, right there. And I can feel right here is where he has a lot of tension. Yes?
Yeah. I know.
He's like, I can come right up to the lateral epicondyle, so I always work from the lateral epicondyle as well. So you can feel the lateral epicondyle, that bone right there when the elbow is bent at 90. All right, so I'm gonna go, that's where it originates. I can go just proximal to that. Ten duele aquí también. Ten dolor aquí también. ¿Sí? All right, so you can go right across it. Right. So he has like just so much pain that you don't have to go digging for anything. You can reduce, so if you see the tightness or the pain as layers, you can go from the top layer, reduce that, and then you can go a little bit lower and lower. Okay, all right. Now, finger is the most important part here. Relájese la mano, relájese el dedo. So someone who's really painful and skittish about moving, then I can start with some tenodesis, right? So relax, the wrist goes into flexion, the fingers go into a natural extension. If he's always abducted, I need to work in a different way. So I'm not supporting that abducted position. I don't want that. I want the finger to be relaxed in. So if you take a look at my hand placement, I've got my thumb right along the distal palmar crease, and I've got my fingers to support that tenodesis position, but it's wrapped around the small finger, so the small finger doesn't go into abduction. So when you start to look at different injuries, you're starting to look at like what is their quote unquote new normal position, because that's not the position we want them to be in. We want them to be in a to be able to use it functionally, and being in an abducted position is not functional, right? So I have to, in order to get him to relax a little bit and to start to move in a more normal, quote unquote, normal pattern, I've got to support that small finger so that it doesn't keep going into abnormal movement patterns. So I've got to reintroduce some normal movement patterns, but in a relaxed, relatively pain-free range, right? So I'm gonna hold that there. Si ahora yo mantengo esta posición, ¿ok? So trata de mover los dedos para abajo un poquito, ese dedo, para abajo, ¿ok? Y para arriba suavecito, para abajo, para arriba, con todos los dedos, ¿sí? para abajo, para arriba y abajo, para arriba. So if I start in a safe place where I'm just moving a few of his fingers, and then if you saw, I moved it 3 or 4 times, and then the 5th time, I engaged a small finger. Y abajo. Para arriba, okay. So that's where you gotta get started. You gotta analyze what they're doing, what's quote unquote the abnormal movement pattern about it, the why, and then work towards a more normal movement pattern based on what they're able to do. Relax, okay.